And a doctor from Leeds who developed long COVID and ME has said that NHS patients like her have been left to rot. Becky Williams caught COVID back in March 2020 and has since been left housebound with a long list of symptoms, including extreme fatigue. Well, Dr. Williams has now joined more than 200 healthcare workers in signing a letter calling for better care for patients with ME, which is also known as chronic fatigue syndrome. Well, it's estimated that it affects at least 250,000 people in the UK, although the ME Association say they think that is likely to be a significant underestimation. The government says it will make sure that patients receive the care that they deserve. With more, here's our health correspondent, Jamie Coulson.
They say I'm not a burden, but I can't help but feel that I am a burden when I have to ask for things. I used to be very independent, and now I have to ask for help to put my clothes on or help to get me to bed. It's heartbreaking.
Becky Williams caught COVID in March 2020. Until then, the 34-year-old doctor lived a fit and active life. But the virus left her with a long list of debilitating symptoms, including brain fog, pain and extreme fatigue. For the past 2 years, she's also met the criteria for ME, also known as chronic fatigue syndrome, which has many overlapping features with long COVID.
I've lost my job. I've just been stripped of my doctor training number because I've been off sick for too long. I've lost friends who don't want to get it or don't get it. I've lost my independence, my ability to drive, to look after myself, can't even wash my own hair. So these tablets are first thing in the morning.
Becky says the upset and frustration over her illness has been compounded by the quality of care she's received from parts of the NHS. She's joined more than 200 other healthcare workers in signing a letter supported by the campaign There for ME, raising concerns about the safety of ME patients and calling for urgent action.
I feel that we've all been left to rot, which I know sounds dramatic, but neglected and not being listened to. And this campaign is giving us all a voice. Just help me.
Her life, her horizons have shrunk so much. She's suffering. We're suffering. Yeah, it's not great.
Can I have my blanket, please?
The government say they're committed to improving care for people with long COVID, ME and chronic fatigue syndrome and recognise how devastating the symptoms can be. They say they welcome applications for high-quality research and are actively exploring next steps. Jamie Coulson, BBC Look North.